here is the patient, the gait of the patient. What is the typical gait of this particular patient? You see the patient walking and tell us what is that particular gait. He is typically showing you that. Come on.
Sir, this is a antalgic gait, sir.
It's an antalgic gait. Why an antalgic gait? Why in this particular thing you said it is antalgic?
Sir, because the stance phase on the right side is decreased as compared to the opposite limb, sir.
The stance phase, good. The stance phase is less. Number 2.
Sir, the pelvis is not dipping any side, sir.
Sir,
there is also
he is lurching on the side, right?
Yes,
Number
sir.
3. He does not want to put full weight on that particular limb.
He is not putting
onto the other side. So these are the 3 characteristics that it is an antalgic gait. So it is a painful gait.
Yes,
mainly
sir.
The gait, by the gait alone, with the history and the gait alone, you have come to the conclusion that this is a painful hip.
Yes, sir.
Right?
Yes,
that is how you build your case. Right. Now you come to the inspective findings. Inspective findings, you will do it with the patient standing and with the patient lying down, preferably. Immediately after the gait, again, you did not make the patient lie down and again go back to the standing position. So with the standing position, with the attitude, what are the things you're looking for?
Sir, in standing position, I will look from front, side, and back.
Yes.
From the front, I will look at the position of the anterior superior leg spine.
Yes.
And also, I will look at the any wasting is there or not, and the level of both the patella and medial malleus.
What will the patella tell you? No, you will have to whenever you answer, you go in a very definitive manner. You come from above downwards.
Yes, sir.
In the lateral position, if it is the front, yes, you would describe the front, anterior superior leg spine and patella, and see whether there is any shortening of the limb.
Yes,
right?
Sir. Yes,
so, if there is shortening of the limb, how will the patient keep that particular?
He can, sir, either there will be an equinus of the same side or the flexion of the opposite limb.
Good. If there is a shortening, then he will keep the other limb in flexion.
Yes.
Come to the lateral side.
Sir, on lateral side, there can be exaggerated lumbar lordosis.
Yes.
And also, I will look for any wasting is there or not.
Yes.
And if any other limb is in flexed position or not, sir.
Yeah, that's it. Primarily, you look into the lumbar lordosis. What will lumbar lordosis tell you, both in the supine and in the standing position?
Sir, if there is an exaggerated lumbar lordosis, then it will tell me that there is a flexion deformity of the hip, sir.
Then that is most probably a flexion deformity, right? Now you come to the palpatory point of it. Even with the patient standing, you look into the what all things do you look into?
Sir, on palpation, I will confirm my inspectory findings, and before that, I will look for temperature and tenderness, sir.
Good.
And I will after that I will confirm my level of anterior superior iliac spine.
Yes.
And also I will look at the femoral triangle and also anterior joint line if it is present or not, sir.
Yes. That you look at the anterior superior iliac spine and the tenderness at the greater trochanter, right? And I already mentioned if the patient has shortening, you will keep the other limb in flexion.
Yes,
or
sir.
the same limb in equinus deformity, right? Now, the next is with the patient lying down, you will mention that with the supine position, is there a difference between the standing position and the supine position?
Yes, sir.
Yes. What are the positions? Again,
in the supine
with the patient lying supine.
In supine position, I will again look for the anterior superior iliac spine, the level. Then I will look for the level of patella and the level of heel.
Yes.
And I will also look if the limb is in the attitude of the limb. Also, I will look, sir, if it is in the position. What
exactly.
position?
You will look into whether there is in the patella you didn't mention in standing. If there is an axial rotation, then you will note the patella and see in the standing. Similarly here, the anterior superior, what would be the difference, a subtle difference between the patient lying down and the patient standing as far as the anterior superior spine is concerned?
So the deformity will be more revealed. And
if there is a mobile, the hip is if there is only shortening of the limb, the patient will try to
compensate
the pelvis. Whereas if it is a fixed deformity, it will be fixed in both the standing and this position. That you will have to note it down. Here, the patient, with the supine position, you will be able to note whether there is an abduction or an adduction deformity looking into the anterior suprailiac spine.
Yes, sir.
If there is anterior suprailiac spine is at a lower level, it is
It is an abduction deformity.
If it is at a higher level,
Adduction deformity.
it is an adduction. So lumbar spondylosis, and you come to the anterior suprailiac spine, the greater trochanter again, you see the palpation and see. What things do you see in the greater